Hey there, I'm Doctor Muji. Welcome to Medbites. Here we break down medicine into simple, bite-sized videos anyone can understand. Today's bite? Let's talk about hypertension, or as you may know it, high blood pressure. The sneaky, silent stressor that affects over 1 billion people around the world. So what is blood pressure anyway? Think of your blood vessels like pipes, and your heart like a pump. Every time your heart beats, it sends blood through those pipes with force. That force is what we call blood pressure. Now, it's normal for pressure to go up and down throughout the day, like when you're exercising or stressed. But when it stays high, even when you're at rest, that's hypertension. It's like turning up the water pressure in your plumbing 24/7. Eventually, something's going to leak, clog, or burst. You've probably heard numbers like 120/80. That's your systolic pressure, the top number, over your diastolic pressure, the bottom number. Systolic is the pressure when your heart beats. Diastolic is the pressure when your heart rests between beats. Normal is around 120/80 millimeters of mercury, consistently above 130/80. We're in hypertension territory. Let's break down the stages of blood pressure. Normal is less than 120/80. Elevated. Top number is between 120–129. Bottom is still under 80. Stage 1, hypertension, 130–139, top, or 80–89, bottom. Stage 2, hypertension is 140/90 or higher. Hypertensive crisis is 180/120 or more. This is a medical emergency. So when someone says, I have high blood pressure, they could be anywhere along this scale. Now let's talk about the two main types. 1. Primary or essential hypertension. This is the most common type, about 90–95% of cases. There's no clear single cause, but it develops gradually over time. It's like your body slowly decides to increase pressure for no obvious reason. Risk factors include genetics. Thanks, Mum and Dad. Aging, smoking, high salt diet, being overweight, stress, lack of exercise, too much alcohol, even not sleeping well. It creeps up quietly, which is why it's called the silent killer. You may feel fine until complications arise. Secondary hypertension. This one happens because of something else going on in the body, and it tends to show up more suddenly. The pressure goes up because something else is pushing it. Common causes, kidney problems, like chronic kidney disease. Hormonal disorders like Cushing's syndrome or hyperthyroidism, certain medications, sleep apnea, even rare things like adrenal gland tumours. This type is usually more sudden and severe, and if you treat the cause, the blood pressure might come down too. Symptoms. Here's the tricky part. Hypertension usually has no symptoms. That's why it's often called the silent killer. But in more severe cases, some people might feel headaches, blurry vision, chest discomfort, nosebleeds, fatigue. Still, most people feel totally fine until the damage has already begun, so regular checks are important. So what's the big deal? Long-term high pressure can damage your organs quietly. It can damage your heart, leading to heart failure. Your heart wears out from pumping so hard, or heart attacks. Brain, causing strokes. Vessels in the brain can burst or get blocked. Kidneys, causing kidney failure. The filters get damaged. Eyes, leading to vision loss from vessel damage. Memory loss. Long-term brain damage from poor circulation. It's like your body's being slow-cooked under pressure. Everything's working harder than it should. How do we diagnose it? We check blood pressure using a cuff. That's the thing that squeezes your arm. But we don't base it on one high reading. We look for a pattern, multiple readings over time. Usually 2 high readings at least 4 hours apart. Sometimes we also run blood and urine tests, ECGs, heart tracing, eye checks, to see if the high pressure has caused damage or to find a cause. Treatment. Let's be clear, it's not curable, but it's totally manageable. Start with lifestyle changes. Cut back on salt, eat more fruits and vegetables, exercise regularly, quit smoking, limit alcohol, get better sleep, manage stress, walk, breathe, laugh more. If that's not enough, we add medications like water pills, diuretics. These help you lose excess fluid and salt. Vessel relaxers, like ACE inhibitors, ARBs, or calcium channel blockers. Heart slowdown meds, like beta blockers. Often people need a mix to get the best result. So, here's the takeaway. Hypertension is super common and usually silent. Once there are symptoms, usually there's problem. It gets worse over time if you ignore it, but you can manage it and avoid serious damage with simple changes and regular checks. Understanding this now helps you help yourself and others. If you found this bite helpful, give it a like, share it with someone curious, and don't forget to subscribe for more bite-sized breakdowns. Right here on Medbites. Until next time, stay curious.